The sinoatrial node initiates single impulses that are transmitted across the atria. On the right side of the screen, note the various regions of the atria that initiate impulses at random and irregular intervals. An external view shows the regular rhythmic contractions of the normal atria at left, as compared with the irregular, uncoordinated contractions in atrial fibrillation on the right. Atrial impulses are conducted through the atrioventricular, or AV node, and down the bundles of the ventricles in an irregularly irregular pattern. The rhythm strip above shows the corresponding irregular patterns of QRS complexes in the absence of the regular P waves that precede each QRS complex on the left side of the screen. In the external view, the normal heart, at left, has smooth, regular, coordinated contraction of the atria, followed by ventricular contraction. On the right side, the atria fibrillate and the ventricles contract normally, but at irregular intervals, as intermittent atrial impulses are conducted down to the ventricles. In this scenario, the patient's ventricular response is rapid at 120 beats per minute. The blood pressure is normal and the patient appears stable. A first-line therapy for stable atrial fibrillation with a rapid ventricular response is diltiazem, given intravenously. The dose for an average-sized adult is 20 milligrams given over 2 minutes. Diltiazem acts on the AV node to decrease the rate of conduction through it. Atrial impulses continue to stimulate the node, but conduction down to the ventricles is slowed, decreasing the ventricular response. The monitor shows increasing intervals between the QRS complexes, reflecting a slower rate. In the next scenario, the patient has atrial fibrillation with a rapid ventricular response of 160 beats per minute. The ventricle is unable to fill efficiently, the blood pressure is dropping, and the patient is symptomatic with diaphoresis. The next line of therapy in this unstable patient is synchronized cardioversion, beginning with 100 joules. Here, the rapid atrial fibrillation is converted to normal sinus rhythm. The blood pressure and heart rate normalize, and the diaphoresis resolves.